and welcome from the Senior Law Day Collaborative. My name is Elena Falcone. I am the Director of Public Innovation and Engagement at the Westchester Library System. I am also one of three co-chairs for the Senior Law Day Collaborative. My partners in this venture include Melinda Bellis and Sarah Steckler. Melinda Bellis is an attorney at the Legal Services of Hudson Valley, and Sarah Steckler is an attorney at Keene & Bean. Today, along with Bruce Siegel, our marketing consultant from Marketing Sense, we are representing the Senior Law Day Collaborative and bringing you one of the several webinars that we have been offering since the beginning of the, well, just about the beginning of this whole pandemic, but since the beginning of April. And I am delighted to be able to bring you this information. Today, you've joined us to hear about essential online information for older adults. Happily, not only do I get to welcome you today, but I also am the person who's going to deliver that content. Before I start, let me tell you a little bit about the organization that's bringing you these webinars. The Senior Law Day Collaborative includes more than 150 professionals who are eager to bring you authoritative, current legal and current information on legal, financial, and health topics. For more than 20 years, we've been providing educational workshops and one-to-one consultations at venues such as libraries and even the Westchester County Center. In lieu of our several events at local libraries and other venues that have been live, this year we're working to bring you all of these webinars that we hope are going to be able to fill the gap until we can meet in person again. So today I want to share information about resources that answer three broad questions. Research, where can I learn what I need to know? Evaluation, how do I compare and evaluate services? And connection, how can I access the services that I need? And at the end of this, I'm going to make sure that there's time available. I also want to review some of the information that we have available that you may want to look at related to COVID-19. But first, a point or two about this virtual environment in which we're in. On Zoom, during a Zoom meeting, all of the participants are muted, and you're going to stay that way while I'm doing the presentation, but you do have a voice. There is an option to use the Q&A button that's somewhere on your screen. On my computer, it's on the bottom. Those, your questions will come directly to the panelists from the Senior Law Day Collaborative, and we'll be able to answer them hopefully during the course of this webinar. If we don't get to answer them actually during the webinar, I can follow up. We have a couple of ways of doing that. First of all, when you use the Q&A, it often has your name and email address associated with it, so we'll be able to email you back unless you choose to ask your question anonymously. But also after this event, you can go to the Senior Law Day Collaborative's website, which I'm going to be showing you, and there's an Ask Us button right there. So you got a question today, you got a question tomorrow, or next week, or next month, or at the end of the year. You can always get in touch with the collaborative. You can get in touch with me to ask your questions. So let me see what else is there I have to tell you. Also, if you have a technical issue, please use the chat. The chat is more public, and the chat is where you can contact other members of the team today who can help you with audio or video challenges that you may be having, which I'm hoping you won't have any. So now let me share my screen so that I can show you our starting point for today's program. And I'm going to be sharing my Firefox screen. Here we go. Oops. All right, so first thing I wanted you to see is the website for the Senior Law Day Collaborative. It is seniorlawday.info. And on this site, we have a link specifically for essential online health information for older adults. And why do I have this prime real estate on this site? Well, this information is in fact essential. It's online, and it is critical for older adults, which is one of the core focuses of the Senior Law Day Collaborative. In 2018, we were able to secure a grant from the National Library of Medicine that allowed us to pull this program together and to print a really snazzy brochure. And the link for that brochure is right here. You can download this brochure. You may find it helpful if you have a printer handy to download it now. You can do so later. You can also connect with us after this event, and I am happy to mail out a copy to you because we were able to print quite a few copies, and I've even done a reprint So this is a trifold brochure. So this is the cover over here, and the first page of the brochure is right here. This is what happens when you open up the inside of the brochure. Why did we get funded to do this, and what actually came about? During the Senior Law Day events, I, as a librarian staffing a table for Westchester Library System, was often asked a number of research questions. And I actually have a prior employment history working for a major consumer organization in which I was a health researcher. So I was happy to answer them, but I came to understand that there was a need for this. And particularly now, particularly in the last 2 decades, but certainly in the last couple of months, we have a need to be smart about this and to be savvy consumers about this information. But darn it, it's really complicated to navigate the health services and the different information products and health products that are available to understand what's really valuable. So this is intended to be a selected, tightly curated list of resources that can answer most of the more typical questions. And it also gives some guidance on how to evaluate some of the information that you're looking at. So I said that I was going to do 3 things. We're going to start with the research topic. So for most health topics, this is where you start, Medline Plus. Now, one of the things that really troubled me when I was doing these presentations over the last 2 years is the number of people who had never gone to any of these websites. So after today, for at least the participants who are here, you can never say that no one ever told you that this good information was in fact available. So Medline Plus is produced by the National Library of Medicine, and it says so right here. It provides authoritative, current information about diseases, conditions, and wellness issues in plain language, and not just in plain language, but in English and Spanish. Let me show you the website. I'm going to click right over here, medlineplus.gov. In this brochure, actually, I'm going to click right back. And this is probably going to make everybody dizzy, but I'm sorry, that's something that is kind of inevitable. Medline Plus, where you can go directly to the website, I have provided the URL right here. Where you can't do that, it doesn't say something like .gov or .com or .org. It says something else, and I give you the information. So medlineplus.gov is a site to which you can directly navigate from this brochure. And when you go there, let's pause to appreciate how it's organized. It's got a basic search box at the top, which works just like Google does. And it's got these 3 broad categories of information that you can navigate, which are repeated here in a more graphic form. Health topics, drugs and supplements, videos and tools. I'm really going to focus today on 2 of these areas, the health topics and the drugs and supplements. I also want to say, what do you know already about this site? It's medlineplus.gov. It's a governmental entity that is creating the site. That means that it's not trying to sell you anything. A .com site tends to be a commercial site as well as .net sites and others, but this should not be advertisements on the site. So you will have 1 notch less of busyness and distraction as you are searching this site. And the source, again, is the U.S. National Library of Medicine. The site is organized by librarians, I'm very happy to say, or at least that's what I imagine, that there's a team of my colleagues behind the scenes here since it's the National Library of Medicine. And I think it's structured in a way that resonates for me, in part because of that. But I'm telling you, that means it's kind of valuable. So when you're navigating through health topics, you're going to see this is a fairly consistent presentation of health topics across multiple websites. So you can go by body location, by a specific disorder or condition, diagnosis or therapy, demographic group, and general health and wellness topics. For the purposes of today, I'm going to jump into eyes and vision. When you go here, in case you didn't know what the different parts of the eye are, and I can always get cornea, iris, and lens confused, then you can start to scroll down these different topics. So let's say you've gone to see your eye doctor and they say you have dry eye, or you may have the early indications of glaucoma. Now the doctor will tell you a lot of good information, maybe give you a couple of pamphlets, but if you're like me and I know that something's coming up, I want to find out everything I can so I can be prepared, whether it's for me or a family member. So Medline Plus is a good place to start. So let's say you find out that your partner or yourself, that you have indications of glaucoma. When you go here, you're going to see this lovely little table of contents for all the information that is displayed on this page. So the basics, learn more. They've got some videos and tutorials, research information, other resources, and some things that are more consumer oriented or how to explain it to others oriented. You can read down through this page if you like, or you can jump to these are all hyperlinks. You can jump to the different sections. Something just to notice, there's a lot of information potentially on this page, and it is one that you could go ahead and print, but you wouldn't get all of those URLs. You wouldn't have all of these links that are here. So I wouldn't necessarily recommend printing out this page. I would recommend jumping to what you want to know or reading it through. So this explains what glaucoma is. And here's actually what I love the best. When they talk about start here, they're pointing you, this is in turn a curated list of resources from the librarians at the National Library of Medicine. They are saying that here are the core organizations that are going to provide you with current authoritative information on this topic. Now, the National Eye Institute, I did not know that one existed. I think I'd heard about the Glaucoma Research Foundation, but now I know that there's another organization that may have information of relevance to me if I'm the person who has glaucoma. The Mayo Foundation is involved in this. I had no idea. The Foundation of the American Academy of Ophthalmology. So what has just happened? Knowing nothing about glaucoma, I now have some basic information, and now I know where else to go for good content, good advice, and good discovery about what I need to know in terms of glaucoma. Now I can start here and jump to those different sources, or I can continue to review. They explain the different tests. I always like that they tend to queue up all the diagnosis and test information in here. And there's another way that they do that I'll show you. They talk about treatments and therapies. Again, National Library of Medicine has identified resources that can tell you all of these different things. Tips about living with glaucoma, related issues, genetics, statistics and research. Am I the only person in the world to get this? And clinical trials. So there's a lot of information in here, and I want to actually pause right here. Clinical trials is is a database that I also could have featured, but because it's linked off Medline Plus, I'm going to talk about it here. This is a quick way. Let's say you know that that your child has been diagnosed with leukemia or something. There is a doctor has advised that, well, there are these treatments that that may or may not be effective. A question that often comes up, because we see it a lot in the news, is, well, are there any experimental medications? Is there anything that can end this? And the option is to look at something like clinicaltrials.gov. Your physician may or may not be aware of these things. By going to clinicaltrials.gov through Medline Plus, they bring you directly to the clinical trials that have been operating or are operating now specifically for the topic that you searched. They talk about which countries they're in. You can drill down to understand if this one appropriate for children, for adults. So this is just a resource that most of you are never going to need to look at, but how cool that it's right there and that you can actually find this information for yourself. Now, of course, unless you're a physician, what are you going to do with this? You're going to take this, you're going to read up, and you're going to go back to your doctor and ask questions. And that's a theme that you're going to hear me say a lot in terms of being bold enough to do some of your own homework and to go back to your physician and ask a question. If there's a doctor who's a participant here, you can raise an issue with that later on if you like. But I think that most of the doctors that I now use and respect are willing to hear my questions and are happy that I'm paying attention. So I hope that you'll find that that's a possibility for you as well. The other thing that I would jump ahead to here is journal articles. Now, I am a layman, but I'm also a librarian, so I know how to look up, I know how to use a medical dictionary, I know how to use tools online. So I will often, if it's a topic that I feel I need to know a lot about, I will read the medical literature. I've got a reasonable education, I can figure it out. You can get access to the medical literature that you kind of hope your doctors are reading as well. You can do it directly here, again, by going simply to Medline, going to the topic that you're interested in, and clicking on glaucoma under journal articles. What that will do is bring you to another resource that I've identified in my essential online health information brochure, Pubmed. PubMed is the place where, what's the number? 28 million, it's more than that now, 28 million citations in biomedical literature are queued up. So I know that I have early stage glaucoma. I've been told, for example, that I should take these drops. I want to know more about how these drops have been tested and what other treatments might be available. I might have gotten some of that information on Medline Plus. I might have found some information in clinical trials, but I want the underpinning of all of this. That's what is available at pubmed.gov. Again, it's a National Library of Medicine site. It's a .gov site. There's no ads. It's just pure information, and it's current and it is deep. 28 million plus citations. So what happened here, if you look up in the search box, is that there was at the back end, those librarians in the National Library of Medicine structured a search that was very specific to glaucoma. Because there's lots of different terms that could have been used, and they brought up articles from the last year that are related to this subject. And I got 84 results, which is pretty substantial. Something I want you to notice. I'm going to call out, I think, 3 things that you could look just for articles that are in full text. Free full text, as a matter of fact. And that is why I'm showing you PubMed. So many more articles are now available in free full text. And when I'm researching something, I want it in my hands now so I can learn more. That literature is available right here. If you are less concerned about free full text, let me go back to here, full text. Full text articles. All of his articles are available in full text, but notice that free article button isn't there. Here's the thing. I work for the Westchester Library System. One of the things that we do for you is we manage interlibrary loan. So if this journal, the Survey of Ophthalmology, let's pick a juicy one, a review of OCT angiography in glaucoma. I don't even, what is OCT in this? Optical coherence tomography. Okay, I'd have to go look that up. This article is in the Seminal Ophthalmology. I'm not sure what that's an abbreviation for it, but this right here is the citation for it, and it happens to be a review article, which is interesting. I'll explain that in a second. I could copy this citation and send it to the Westchester Library System, and we'd find you the article. We'd hope you had a good reason to want it, that you've read the abstract and it particularly pertains to what you want to know. But if you don't have the free full text available to you online, you can also ask us to get it for you. I'm going to do a digression and jump over to my website, westchesterlibraries.org, and remind you, because of the pandemic, we may not be as quick with this, but we have something called Interlibrary Loan Services, which I just hit the wrong one. Go here. I didn't check this before we came in, and that link is not working right now. Right, there it goes. There it goes, ILL services. So you can request an article under account and catalog ILL services, and we just need the information that you just got from PubMed. So again, you can get the information that you need so that you can understand the health topic that is of concern to you now. Let me go back to PubMed and go back to that list of articles. You can also look for something, I believe all of these are probably going to be review articles. Not all of them. Out of 84, they're not all review articles. Oh good, they give you a choice. So there are these filters off on the left-hand side that you should make use of. And I'll say that also for Google and other tools. Make use of the available filters so that you can winnow things down appropriately, but not in a way that's going to compromise the rich information that you're going to find. Review articles are a key tool, I think, for us as laymen, self-educators in the topic of consumer health. Review articles summarize a specific topic. So they tell you the lay of the land. So what are a review of this particular technique in understanding glaucoma. And it will tell you, we looked at what the state of the art is for the last 5 years, the last 10 years, the last year. A review article is ridiculously valuable if it addresses the topic that you're concerned about. If you look instead for systematic reviews, I want to make sure that you see the distinction. Okay, there's only 9 results for that one. That tends to be where the researchers are taking data and trying to see these 5 studies have all said different things. Let's put the data together and kind of average it out and see what it tells us. So they're really working with the data that come from different studies to answer a specific question. A general review article, the one I was selecting before, let me take that off there. There were 61 of them, tends to just summarize what everybody has said. So keep that distinction in mind. One is a broad summary, and the other one is answering a very specific question by trying to look specifically at the data that addresses that question. So that's probably as fancy as you got to get for any of this. You could certainly do much more sophisticated and exhaustive searching in Pubmed. If you ever want to do that, give me a call. But for most uses, you can simply jump from Medline Plus to your topic to Pubmed to look at the underpinnings of the literature. I say that, and one other thing I can say is that, let's say your topic is kidney stones. You can also, just like you would in Google, jump into that search box, type your phrase, and this is a pretty smart search engine the same way Google is. You can find the articles you want. Look, the very first one that comes out, this is the display option that's by best match, is a recent review article on kidney stones. Woo! You just found probably most of what you need. That article is available for free. So you can go in here, you can check out the abstract, and then follow through over here on the right-hand side for the links for full text. A heads up, they'll often ask you to make an account, but the full text is there. You don't have to pay anything for it, which is, I think, a wonder. How did we get here? We started out by simply going to medlineplus.gov. So clearly, if there's one website I want you to remember, it's this one. And Medline Plus really works well when you search using the health topics. The other area that you might want to look at are drugs and supplements. Actually, before I go to drugs and supplements, I want to go back to the main page, and I want to also go down to medical tests. So when you're looking at glaucoma, they may tell you that they want you to take a certain test, blood test, or whichever. I forgot which ones were for glaucoma. Let me just jump into this one. You've had blood work done with your doctor, and they tell you have a high level of alkaline phosphatase, and you ask, what's that? Or maybe you don't ask, what's that? Which is what I hear people often do. I'm the one who asks, what's that? And you forgot, and you can go here and find out exactly what that meant in your blood workup and what high and low levels mean. So there are lots of tests that we're given, it seems almost as a matter of course. If you want to understand some clear consumer-directed information about those different tests, you can go here. It's a great resource that's available on Medline Plus. Now, where was that? I was on the main Medline Plus page, and I am these are the three areas that are featured, but right under there, medical tests is also, I think, a great resource. Anything else I wanted to say about Medline Plus? No, I think I covered everything. I don't see a question coming in. Don't forget, you can ask questions. Okay, someone's asking, is there a short document that they can print that they can read later? Yes, you can print out the brochure that I was showing you on seniorlawday.info. So keep that in mind. The other thing I want to show you is drugs and supplements. So concurrent with our medical conditions, we may also be taking a variety of drugs and supplements to stave things off or to manage current conditions. This is a good resource for both prescription information, generics, and for, I won't say it's the best thing for supplements because I'm going to show you another resource as well. So for drugs, let's say you've been diagnosed with acid reflux and you're given Pepcid. I'll go to the P's. You're given Pepcid, which is going to be in here alphabetically. Pepcid. So it tells you the brand name. Here goes Pepcid. And it's going to tell you what the generic is, famotidine. Famotidine? I'm not sure which way it's pronounced. What you have here is all the information that is in the insert that you may have thrown away because they're often hard to read and they seem kind of dense and overwhelming. This is that information, but enhanced and presented in a way that is not dense and overwhelming. Again, good librarians at National Library of Medicine, they've given you a nice hyperlink table of contents at the top. They've made this to be more of a plain language document, and I think it's fairly easy to navigate. So I don't worry about, oh, that thing got thrown away. I know I can always go to Medline Plus here to review the information about how much I was supposed to take, what side effects are, what my favorite question, what should I do if I forget a dose? That's available here both for search by the generic name and by the brand name. Let's now look at what they do for supplements. So I often don't read this page well. So drugs, herbs, and supplements. Drugs is here, this section, which has the nice A to Z link. Down here is herbs and supplements. I want you to notice they're giving that a secondary position for a reason. So herbs and supplements. They've got, now you have your A to Z list. Let's look at my favorite one, calcium. I'm a female, I'm older. Calcium is something that we're always talking about. So this is again a plain language review and summary of what we know about calcium supplements. And I actually think this is a fabulous review. It also has a table of contents. It's done by the National Institutes of Health, all related with the National Library of Medicine, but you notice it has a different look from the pages we were on before. You can review this and get a lot of definitions and good information about calcium. One of the things we know for sure is that calcium supplements are not necessarily proven to stave off osteoporosis. Calcium in your diet is. But many of us are still taking supplements. I'll get to that in a second. So are there any interactions I should know about? Where can I find out more? Can calcium be harmful? Again, a fairly comprehensive and I think easy to read and useful tool. The thing is that people still take calcium and they take many other supplements. So I hope that their decisions are informed. To that end, what I'm recommending, and let me go back to my brochure. We've just talked about this. You can see I'm gonna go fast through other things. What if you're taking a calcium supplement or some other supplement, and you know that you should know, even though it's a multi-billion-dollar industry, that there's not often any evidence that these supplements are proven to address the concern that you may have. You're taking it because you're hopeful that the research will eventually show that that is the case. So, but you're probably spending a lot of money on these things too. How can you figure out if you're just wasting your money? You can go to Consumer Lab, which is available on the Westchester Library System website. So here I'm circling with my mouse over here. Here goes taking a supplement, here goes Consumer Lab. And I don't give you the URL for Consumer Lab because I tell you we're paying for it for you. So you have to get at it through our website with your library card. So now I'm going to go to the Westchester Library System website. And I'm going to go to the research tab of the westchesterlibraries.org website. Our site should be a similar display to some of what you've seen so far. Here go several areas we have under research tools. I'm going to expand the health tab, and you'll see that you can access consumerlab.com in a library because we recognize all of our IP addresses for our computers, or you can do it at home. If you're going to access it at home, click on this and put in your library card number. 210-8328367. I want to make sure I remembered that. And your PIN number. So put your library card in, and I want Firefox to save it right now. So now I'm in Consumer Lab, and this has a pretty good search engine in it, but what I really love, and the reason I'm bringing you here, is that they have great review articles. So whatever it is you might be taking, probiotics, you're drinking bone broth for health, bromelain, CBD oil, calcium. So I'm selecting a review article. Now remember the word I was using before in Medline Plus, review article? This is the first kind of review. They're telling you the lay of the land. Like Medline Plus, they have this nice hyperlinked table of contents at the top. Unlike Medline Plus, you actually could print the whole darn thing out. Actually, they're very keen about you actually could print this out. And it is going to be a lot of pages. I'm going to make you dizzy for a second. I'm going to drag you down through this whole document. Okay, there's a lot of information in here. So what is it that they're telling you? They're giving you a nice little summary about what they found and what it is, and they're linking you to the literature and they're comparing prices. What? This is a lot of information. So look, we know that the supplements, if the supplements were proven, that'd be one thing. But by and large, there's a lot of tests that indicate that there may be some benefit, but they're not conclusive. So I think it behooves us to know what we're investing our money in and how much we should trust the efficacy of these things that have not been proven. You can do that here. you can also figure out if you're going to take calcium or you're going to take extra magnesium or whatever else, you don't have to pay so much for what you're purchasing, because they're actually doing kind of like a Consumer Reports-esque, comparison of the pricing. And let me show you what that looks like. So what it is, what I meant to say is they're also testing what can be tested. So I'm going to do the comparison to Consumer Reports. Consumer Reports looks to see whether or not that vacuum cleaner or that dishwasher actually does what it claims, and does it work the way people expect it to, and what's the best price for the money. This tool does the almost all of that, but it can't tell you if it actually does what it says it does, because there's no evidence that it does. It tells you what's been reported in the medical literature. So, and they also do a price point comparison. So here goes a summary. What it does. Notice there's a lot of hyperlinks to the actual journal literature that's available in Pubmed. So if I click on this, let me see, Robbins Menopause 2013. Actually, this one's taking me directly to a journal, but it will often take me into Pubmed where that journal article maybe had. So this is a direct link to the full text. More importantly, when you go down to what we found, whoopsies, what they tell you what they tested for, the labeled amount of calcium, the purity of the calcium, and the ability to break apart for absorption, things they could actually test for. And then they found that some things were not approved because they didn't meet that criterion, and they figured out which ones were the best value for the money. And you could also factor in pill size and other things. I haven't got the time to go through this whole thing, but these, if you're taking a supplement, do yourself a favor and take a look at what Consumer Lab has to say about it so that you are more confident about what you're actually using. So I'm skipping through a couple of things, and I wanted to pause here. I don't see additional questions, but what I do want to review is to get core information about a health topic. Please go to Medline Plus, use their drugs and supplements information, use it for medical test information, and further, if you are determined to take certain supplements, do some research on them, particularly now during this whole COVID-19 thing. There's a lot of supplements being touted. Everywhere you'll see that there is no evidence that any of these remedies are proven to cure or prevent COVID-19. And you'll see that on all of these sites. So if you're taking one anyway, you should read up on what it does, good and bad, and sort of, I think, couch your enthusiasm appropriately. And also make sure you're not just wasting your money. So that is for getting well. How about staying current on a topic? The next thing I want to bring you to is McMaster Optimal Aging. And I want to talk a little bit about my favorite source, Medline Plus. Not Medline Plus, WebMD. So Medline Plus had no ads. Pubmed, no ads. Consumer Lab, subscription-based product, no ads. McMaster Optimal Aging Portal, no ads. Why don't I like ads? Because they're distracting. Because I'm here to get information on one thing, and I wind up going down rabbit holes for other things because people are sort of giving me, because Google search engines, whatever, are serving up what they think. Hey, if she's looking at glaucoma, maybe she'll want to see this thing about eyeglasses. No, I just want to find the information I need. So those sources are key. But when I want to keep track of a topic, I tend to go to two sources. I go to the New York Times because I think their health and wellness coverage is terrific. I also go to McMaster Optimal Aging, and I sign up for their weekly alerts on new information sources. And I don't have a lot of time to go through this site, but I would invite you to take a look at their healthcare and health delivery service items, read their blog posts. What they do that's key is that they compare they look to see if a site is basically on the up and up, if medical studies are using clear evidence to support their claims. So they're really looking at a lot of information with a critical eye. A note that this is a Canadian site, so the health policy prescriptions don't necessarily apply to our environment, but their health information is really quite sound and a lot less busy than you'll see on something like WebMD. I'm not going to search WebMD. I use WebMD, But you know, when you go there, there are a lot of ads. There's a lot of clickbaits, and they always give you, this is the only intrusive pop-up that you'll ever get from McMaster Optimal Aging. WebMD, it's just kind of relentless because they're doing a lot of marketing, and that's how they make a lot of their money. So I'm not criticizing their information so much as I'm saying it could be presented in a way that is less distracting. And let me just check my chat a second. You know, if I were to do this research, there's a question here, do you recommend using this research on computer versus a phone? Just like doing a job application, don't do it on a phone. There are so many other windows and pop-ups that come up in a lot of these websites that you may not be aware of. You kind of want to be able to see the full lay of the land. If you were to look on Medline Plus on a phone, I think it scales differently, so you wouldn't see all the options that I just told you about. So if it's a new resource, if it's a new site, investigate it on a computer, and then if you're familiar with it, then you may be better prepared to search it on a cell phone. Maybe it's just my own vision, but I find it much more comfortable. That said, the phone's in our pocket, so you're gonna do what you're gonna do. Are there other resources? You know, if you have a resource that you think is particularly solid for keeping on top of medical information, please go ahead and, you know, add it into chat, and I'm certainly willing to find a way to promote that. But again, New York Times information on this I think has been really powerful and good. Let me shift now from looking at information that is, you know, just to get yourself informed on a topic, and shift to ways to compare doctors, hospitals, and other health services. And I'm going to show you that is, there were a few resources here that I didn't drill down on, and we just talked about McMaster Optimal Aging. Now, I want us to think about the other thing that we have to do as consumers of health services, which is, you know, figure out, what doctor do I use? Is that hospital safe? Even though that's certainly a huge question now. Is that rehab facility one that's going to do everything I needed to do for me or for my family member? There are ways to answer those questions, and it is on you to do the research to figure that out, because this is a competitive marketplace for health information and services. We are consumers of those services, and the only way we have both rights and responsibilities as consumers. And our responsibility is to walk in with our eyes open and having done our homework. And libraries are here to help you do that. So if you're going to evaluate a doctor, because sometimes you have to change doctors because your health insurance has changed or because you have a new condition that requires a specialist. So to compare doctors, hospitals, and other health services, these are some of the questions that I would like you to consider. Of course, you have to figure out if they're covered by your insurance. It's good to know with which hospital they are affiliated, and I'll show you a little bit later why that's especially important. Are they certified in their specialty? Are they certified in their state? Are they licensed? What has their experience with malpractice been? There are ways to know some of this. And what are their office policies? Like how happy are people sitting in the waiting room? I have left 2 doctors so far whose offices were chaotic, and getting things like refills or appointments confirmed was just a chore. So it doesn't have to be that way, particularly since we have a little bit of consumer choice. And do they use patient portals? How do they manage electronic records? How difficult is it going to be to communicate from one doctor to the next? In this environment, these are the types of questions that we have to ask. Some of that information is available through a couple of the websites I'm going to show you. Some of it is you going in and asking questions and keeping and observing. You can check out 2 doctors, see if you like one versus another. Don't think that if location is the key thing, then pick the one that's closest. But you might also want to research them as well to make sure that that's an okay choice. So the 2 sites I want you to know about are NewYorkDoctorProfile.com and HospitalSafetyGrade.org. Let me take you to NewYorkDoctorProfile.com. It is a .com, but it's in fact a New York State website, so someone didn't purchase the URL fast enough. So NewYorkStateDoctorProfile.com is not a pretty site, but because of licensing requirements for doctors in the states in which they practice, they have an edge in being able to collect information. If you click here to search for a physician, it's got a simple name search as well as a more advanced search. I'm going to use a doctor who is known for eye health, and in my area, and I'm going to type his last name in because it's nice and relatively unique. Dr. Kayvon Kahani. He's an ophthalmologist in northern Westchester, rather just in New York. So I simply did a name search for a doctor, and I know he's got a license, he's got certain ID numbers. He last updated this profile in 2018. So there's a combination of information that's received from the physician and that also is received from different licensing boards. That is all aggregated here. The way this layout is not the friendliest because I'm looking at this thinking, oh, it's a blank page. Click on a topic above to learn more about this doctor. So here you go. You can look up his education, his professional memberships. You can find out some information about his practice, things that he has or has not or isn't reported. It notes what health plans he's actually participating with. I wouldn't take this to the bank. You still have to call and ask a doctor or their office. You have to confirm that they're actually taking your health plan. It also notes what hospitals this doctor is affiliated with. That's going to come in later. So this person is affiliated with Hudson Valley Hospital Center and the New York Eye and Ear Infirmary. So that's interesting. Legal actions. Only if there were, I believe, settled, if things were settled out of court, it wouldn't be here. But if they actually were charges made and proven, then they're actually going to be here. If you see something here, you should feel emboldened to ask your doctor, hey, I'm really interested in going to you, but I saw something on the website and I want to understand. These guys are in a tough position, ophthalmologist, the orthopedists, have some of them treat especially challenging cases. Some doctors may have a particularly sick patient group, and people die and things happen. If you've read any of the books that have been out lately, written by doctors, you know that they're under a lot of pressures and mistakes are made, and that's part of how they learn. That said, you should feel comfortable asking your potential doctor about that information. And if they're cagey or don't want to answer it, well, darn, why not? I want this person to be honest with me since I have to be so honest with them. So you could ask them those questions. Professional activities and statements. So there's a lot of, so he's also a teacher and other things. So there's quite a bit of information on this physician. Go ahead and check out yours. If your physician is actually, if you're in another state, find that state's licensing board, and that's where that information can be found. Now, I noticed that he is part of he uses Hudson Valley Hospital Center. So I'm going to go to hospitalsafetygrade.com. Did I get that one? Oops, I can't type, so that didn't work. Hospital, let me get rid of this. Hospital Safety Grade. I'm switching tab. Hospitalsafetygrade.org. It's a nonprofit organization. Okay, again, not someplace where they're going to be giving you a lot of advertising, which is wonderful. These guys do the hard work of kind of like those systematic reviews I was saying. They collect data and they present it in a way that you can start to evaluate the safety of your hospital. So they've determined what criteria are the important ones to look at, which is also shaped by what criteria was their data available to collect and assess. So there's a lot of back-end thinking about this that I encourage you to read about by going to this site. But let's say we know that by zip code, 10566 is, I think, where the Hudson Valley Hospital is, 10566. So I'm just going to search within 50 miles of that hospital. Okay, New York Presbyterian Hudson Valley Hospital. Now, when I do this presentation, actually, I hope this is still viewable, and make sure it's in the right window. Hang on. Okay, when I do this presentation in libraries, what I find striking is that everybody goes, what? See? It's hard, you're gonna be hard put to find A's among hospitals because they have a lot of challenges. And right now, the data is probably not going to be very good for anybody because there's so many challenges related to COVID-19. And these guys have been talking about some of the things that they're doing to manage that situation. But going through this list of hospitals within 50 miles of that zip code, there's a D. Oh, good, Putnam Hospital Center has an A. You should figure out why. And this tells you what letter grade was there. So you should probably want to know, well, how low does these grades go? I think it goes to F, as I recall. So C doesn't look so bad if it goes all the way to F, I guess. They tell you when the data was last updated, and you should take a look at the full score. So let's view the full score. They are reviewing the hospital based on a number of different criteria: their ability to handle infections, problems with surgery, practices to prevent errors, so how they're thinking ahead, safety problems, and really whether or not there's appropriate communication between doctors, nurses, and hospital staff. They're measuring what can be reliably measured and assessed. So they're not measuring everything that could be measured, but they're measuring what they think is important and relevant data. And so first they give you a summary grade, and then that grade breaks down into these 5 areas, and you get to go in and look. So if my doctor is affiliated with this hospital, and another doctor is affiliated with the hospital that maybe has a better grade, let's say I have to go for a certain type of surgery, I might want to go here to look and say, oh, what kind of problems do they have with surgery? The surgical wound splits open. Death from a serious or treatable complication. Serious breathing problems. What can I do? What if I trust my doctor and like my doctor? I would take this information to my doctor and say, hey, I was looking up the hospital where you're going to do this surgery, and they've got these issues. What are you going to do to make sure that I'm going to be safe? And what can I do? The what can I do, in part is coming out of here, because they tell me what safer hospitals do. One of the ones I always go to is infection in the urinary tract. That happens because catheters are left in for too long. So I, as an advocate for my friend or family member who's in a hospital, is the pain in the butt for saying, hey, when was that catheter last changed? I just wanted to check. Is that done every 2 hours, every 6 hours? What's the schedule? So I'm going to be asking those questions and keeping an eye on that, because that is something that happens. Now, you also have to have a little number sense and read through this. This gives you a pretty good sort of understanding of this. The best hospitals would have 0. Right? The best hospital has a 0 score. The average hospital is 0.7. This one is a little bit high for that. It's more than twice as much. So it's close to the worst hospital score for that. Now, what could be the reason for that? That could be not adequate, inadequate, not enough nursing staff. There's something to think about in that. So that's why you're being an advocate for your friend or family member is so key. Know about these things. Know the questions to ask, know the things to look for. And you can go through these for all of your hospitals. It's sobering. The challenges that hospitals are facing to do this work is even more so right now. So we need all eyes on the ground if we can to help people out. And now you know the questions to ask of the nurses station when you are calling up. So you can evaluate the doctor asking some of the questions that I was framing over here. And you can also take a look at what hospital they're actually associated with. Again, these are good things, I think, for you to read through. The other thing that you can do, rehabs have come up fairly often, and I would advise, since this is a program for older adults, that you be familiar with what Medicare.gov can do. I'm going to go to Medicare.gov. And Medicare.gov is an important site for managing your Medicare, for looking at your Medicare service notices, for printing out your card, for an array of things. What I have used it most for has been to find care and to search for providers and facilities, particularly searching for rehabs. So inpatient rehab facilities, long-term care hospitals, dialysis facilities, nursing homes. Okay, all of these things can be evaluated here. And I use my favorite example of in Brooklyn, 229. In Brooklyn, New York, a family member needed to go to a rehab. And You can compare these facilities, Brooklyn Hospital Center. Oops, I wound up with the one I didn't want to go to. Rather than go through this, I'm going to say what when you can compare two facilities side by side. And one of the key things that comes up in rehab especially is the number of hours that people that physical therapy is made available. So after surgery, you're going there because you've been on your back for a week, you need to get strong again. And you can look and see which hospitals are rated, which rehabs are rated higher or lower for those number of rehab hours available. What's the key driver for the surgical infections that we saw in the hospitals and for rehab hours in a facility? It's available nursing staff. So something to do is to look at the ratios of nursing staff to patients, and something to look for when you go and check out the hospitals and the rehabs is how many nurses are on duty. Who's going to be caring for my family member, for me, during the time that I'm there. So again, another site that you can use to arm yourself with information and appropriate questions so you can make a good choice. So I've gone through now to comparing hospitals and other things. Before I leave this topic, I want to go to one more source. On the Senior Law Day site where I've linked this brochure, I've linked all of these resources. And oops, I guess I didn't link this one. I'm going to show you one more thing. Consumer Reports 5 questions to ask your doctor. I'll fix it so that you have that link. A couple of years ago, Consumer Reports produced a little wallet card, which I still have some available of. And if you contact me, I'll mail it to you. And it worked with this group called Choosing Wisely, which is evaluating all the medical tests and procedures that are done to see which ones are actually the most efficacious. So that's a great effort, and it's an effort both to save us time and money. But they determined that these are really 5 good questions to ask every time your doctor tells you you should take this drug or do this procedure. Do I really need it? Okay, is this an elective? Right now, no one's doing elective surgery, right? So do I really need it? What are the risks and side effects? What happens if I don't do it, right? Are there simpler or safer options? What happens if I don't do anything? And how much does it cost, and will my insurance pay for it? Those 5 questions are really key to a good relationship with your doctor. They're really key to evaluating the impact on your wallet and your life. And they're really just key to your overall, to your life, to your overall health and well-being. And in every presentation I've done for this, people have said, I would never ask my doctor those questions. I'm hoping that you will change your mind about that after you've done some of the research that I'm pointing out here. It's worth it. And doctors really do doctors don't have enough time for us generally, or as much as we'd like. Even with telemedicine. So if they have to give you enough to go on so that you can manage your own health, because they really aren't managing it for you. So these questions are really important to ask. If you want one of those wallet cards, make sure you contact me and I will send it to you. Okay, let me go back to my brochure here. The other thing I wanted to show you is is how to get help. So for all of this, you can go to the seniorlawday.info website and ask questions of health professionals, lawyers, financial planners. And we're happy to help to direct you. You're also asking questions of librarians, and I will be able to give you guidance on this. I'm going to go to the back page over here. I briefly showed you Medicare.gov. So this is how to connect to services. So managing Medicare is a significant task. Enrolling in Medicare via socialsecurity.gov is also a significant task. All of these are related, but I'm not going to go over them now because I also run a program called Westchester Seniors Out Speaking, which provides the senior benefits information centers. We normally are housed in about 9 or 10 libraries throughout the year where you can walk in and ask your questions. Right now, if you have questions about accessing any of these services, you're able to call us. You can you're able to email us by going to our website, Senior Benefits Information Centers, which is available right off the Westchester Library System site. And we also have a wiki that I'm going to show you. So you see right here, Senior Benefits Individual Counseling Services. If you go here, you'll see there's a phone number, 231-3260, and a website, civics, or an email address, civics@wlsmail.org. We can help you navigate the whole maze of accessing Medicare-related services, understanding Medicare Advantage plans, and other related benefits available in the county. Finally, I wanted to jump ahead a little bit because I just wanted to give a few words about Googling. So all of us are probably going to start our searches by Googling, and we're going to jump in and type in kidney stones, and all kinds of stuff is gonna come up. I'm not saying it's all bad, but one thing I definitely want you to take note of. So if I go to google.com, so I'm just gonna go to the actual website and I'm gonna put in kidney stones. You're gonna get, so Google does this nice thing, as do some other sites, where they pull something from a source like, you're gonna tell me what the source is. This is probably Wikipedia, but no, it's Mayo Clinic. So they're pulling it from an authoritative source to give you a quick answer. There's an ad here from the American Kidney Stone something or other organization. There's a couple of .orgs, but pretty quickly you're going to get into newsy sites. This is stuff where you're going to start to see a lot of ads and a lot of distractions. Images for kidney stones. Okay, healthline.com, it's a newsy site. urologyhealth.org. Okay, I might want to check there first. So just be sensible about where you're going to get information. But I didn't get, oh yeah, what I wanted to show you is this. Just because Google serves this up, people also ask, how can I flush out kidney stones? Okay, this one comes from, here's some notions from Medicare, from Mayo Clinic. How can I pass a kidney stone at home fast? Now we have something from urologyspecialists.com in North Carolina. All right, why should I trust them? What are the 4 types of kidney stones? Okay, that's from kidneysfund.org. What I have found is that there's more newsy sites because they do more search engine optimization than there are the sort of the reliable authoritative sites available here. So keep in mind that just because Google has figured out that other people ask these questions, that doesn't mean they're serving up authoritative answers. They're serving up answers that rank high in their search algorithms. Please keep that in mind. The other thing I want you to consider, so that's what I was talking about here, and check your sources, is if you're searching on a computer with let's say you're sharing a computer right now during this pandemic, and a lot of people are using this, and you don't want people to know that you're looking up kidney stones because you don't want them to worry. You might want to use incognito windows. So if you're in Firefox, for example, or Google, or Safari, you can go and look and use something called a private window or an incognito window. That will not save your search history. It will not be something, the minute you close that window, all of those results are evaporated. So you could actually have some privacy in sharing a computer. If you're searching on Google and you don't do that, then you're suddenly going to be getting ads for kidney stone related products. You know, that Google is tracking us in a lot of ways. That actually there's a presentation coming up on June 9th about privacy that I hope you will participate in, because that will give you some leads on some of the choices that we are making and that we have a choice about in terms of how much information is captured about our search behaviors and the things that we're interested in. I would encourage you to target your search. If you are doing something in Google, you will notice that there are filters. Oops, I lost my Google search results. There are filters, here they are. Under tools, you can search anytime, or results, or settings. You can switch in terms of what language you're going to use. Anytime. I want results from the past year versus at any time. And they changed this one on me again. So this is not the best example for that. But look for filters that are available to further refine your search. And that's about it. Those are actually there's one last thing that I want to point out. So I hope you'll all download the brochure, but I'm going to leave you with this. Here are 5 things to consider when you're looking at resources on the web. Is the information that's been served up to you, when was it published or posted? How current is it? Is it really relevant to the question that you're asking? Because remember, a lot of things come up with the Google search box that can just be a distraction and not necessarily relevant to your question. It's going to waste your time, and that's valuable. Is it authoritative? Is this a newsy site with a bunch of editors who are trying to get ad placement to pop up? Or is this a bunch of doctors? Go ahead and look at the About Us information on a website. Is it accurate? What about this information tells you that it's factual or scientific? Or is it an emotional piece that someone's written about their singular experience? And finally, what was its purpose? Was it written to inform, teach, sell, entertain, persuade? All are fine, but know what you're basing your decisions on. And yes, there is a handy acronym in there that I hope will help you to remember this. So I did a lightning review of this content. I hope that you will download the brochure, which is available at seniorlawday.info. I hope that if you have any questions after this, you can go to the Civic site, or you can also go right here to the Senior Law Day Collaborative website and click on the Ask Us button. And that will get to our lawyers, financial planners, geriatric care managers, nurses, and librarians, and many others who will be able to help you, to direct you to an appropriate resource and to follow up on anything that we've raised in this webinar or any of the, 10 webinars that we've made available and posted here since the beginning of April. Everything on homes, to Medicaid redesign, to elder law topics, to elder abuse, and just a dialogue with a financial planner. So please use the information available to you, be an informed consumer, and don't forget, libraries are going to reopen soon. So you can call us now, but you can hopefully soon you'll be able to walk in and ask your questions.